Hemorrhoids is the condition of swollen veins around anus and lower part of rectum that causes discomfort during bowel movements or sitting. There are two types of hemorrhoids. Either they may be located inside the lower part of rectum, which is called internal hemorrhoids, or they may develop under the skin around the anus and called external hemorrhoids. The main reason for developing hemorrhoids is straining during bowel movements. There are also other reasons like sitting for a long period of time on the toilet in case of chronic diarrhea or constipation, or due to obesity or pregnancy. But it's a very common issue and most people will suffer from it during some period of their lives. As we said, hemorrhoids causes discomfort during bowel movements or while sitting. It can also cause bleeding and pain. For example, you may see blood in the stool or on the toilet paper, or you may feel swelling or a lump near the anus as shown in this picture. The diagnosis is done by visual or physical examination. For example, in this cartoon, you see the patient has gone to the proctologist and the doctor performs the rectal exam and then says, "The good news is you're fine, but the bad news is I'm stuck." So that was just a lesson that next time when you go to proctologist, just hope he doesn't get stuck. So let's go to the treatments. There are some home remedies for hemorrhoids, like sitting in warm bath for about 15 minutes several times a day, especially after bowel movements. You should also make sure to eat high fiber food and vegetable to prevent constipation and straining. There are also over-the-counter creams that can help relieve pain and itching. But for very advanced cases, you may also have to undergo surgery. It should also be mentioned that if you are a middle or old age person, the bleeding during bowel movements can be the sign of a more serious problem and you need to see the doctor first.